Welcome to SheTV.com, where board-certified physicians talk to you about women's health. This video features Dr. Arielle Allen, a board-certified urogynecologist, explaining exactly what a urogynecologist does. She is interviewed by Dr. Dana Bach, a board-certified anesthesiologist.
Hello, welcome to SheTV. This is the channel that's dedicated to women's health. I am Dr. Dana Bach. I am here with a friend and a colleague, Dr. Arielle Allen. Say hello, Arielle.
Hello. Hi, everyone.
Dr. Allen is a urogynecologist at Lakeside Women's Hospital, and I wanted to talk with her today and have her explain what a urogynecologist is. Can you tell me, Dr. Allen, what your specialty involves?
Absolutely. Urogynecology is kind of a new and upcoming specialty. It's actually a subspecialty of OBGYN and urology, and it encompasses the health and well-being of the female pelvic floor. By that, I mean we, as urogynecologists, we take care of bladder issues for women. We take care of prolapse, or when the pelvic organs fall. And we can take care of some bowel issues as well. So everything that is in the female pelvic floor is our specialty and what we take care of for women.
Okay. Tell me about your training. What is involved in training to become a urogynecologist?
Sure. So to become a urogynecologist, it does require a lot of years of training. A urogynecologist can come from either an OBGYN road or a urology road, meaning residents that complete an OBGYN residency, the full 4 years of that residency, can go on to do 3 years of a urogynecology fellowship. If you are a urology resident and you complete those 5 years of residency in urology, then you can go on and do 2 extra years in urogynecology fellowship. Either route, you can become a board-certified urogynecologist.
Okay, so we're talking 7 years of training after medical school. So you
correct.
have your 4 years of college, 4 years
Yes.
of medical school, and then
Yes.
7 more years of training.
Yes.
Wow.
Yes, it is a lot. It's a lot of years. You gotta love this profession to want to do all that.
And I guess you do. Do you love your profession?
I do. I love my job. I tell
Okay.
patients every day, I love my job.
Well, tell me a little bit about that. I guess maybe what are the things that make you smile and make you happy when you take care of patients, and maybe what is a frustration when you're taking care of patients?
Absolutely. So I would say the thing that keeps me going every day is the ability to be able to improve a woman's quality of life. Patients come to see a urogynecologist. They come to see me when they have issues with urinary incontinence, for example, and they are afraid to leave their house because their urinary incontinence has gotten so bad that they fear smelling like urine or having an accident outside of their home. And that is incredibly embarrassing.
So they won't leave their home for the fear of that.
Yes. And so that inhibits their activities. That inhibits them from going out and doing the things they enjoy in life. That inhibits them from seeing their family members or grandchildren. And so they come to a specialist like myself, and we can provide so many different treatment options to treat that problem so that they can enjoy their lives. They can go out and see their grandchildren. They can go out to the movies. They can go out shopping. They can do the things that make them happy. So what keeps me going every day is when women come back after allowing me to treat them, and they tell me how much I've changed their life and how much they appreciate what I've done for them. And that's what keeps me going. And that's what I love about my job, is being able to improve the quality of life. Yes.
Yes. And so that is a life-changing. You are a life changer for those people. Yes.
It's very rewarding for me. It really is. For someone in my specialty, we are rewarded with those comments from patients every day. It's great. It's great. You asked me about frustrations.
Yes. Do you have any frustrations? I mean, you may not, but usually there's a frustration that goes along with the great part.
Yes, I think there's frustrations in everything, in every specialty. And I would say mine are probably no different than other specialists in that sometimes we suggest behavioral modifications or things that patients can do at home to help their symptoms. And sometimes patients are just not compliant. And that's frustrating for us because we are offering these treatment options to help them. And if they're not willing to help themselves, it's frustrating for us. And so I would say that would probably be a big frustration for me.
And that makes sense. They come to you wanting to be helped, and you give them ways to help themselves, and then they don't follow through. That would be
Yeah,
very frustrating.
yeah. It's similar to I'm sure endocrinologists telling their diabetic patients to avoid sugar in their diet, and some diabetics just don't do that, or cardiologists suggesting patients reduce the cholesterol in their diet, and some patients are just non-compliant, and so that can be
Like,
frustrating for physicians.
yes, yes, that's true. Well, what about as far as just more like a brief overview of treatment, but are most of your treatments done in an office setting? Are they done in an operating room setting? Both? Kind of, I guess, in general.
Absolutely. So all of the above, I would have to say, depending on what the patients are seeing us for. For most of the diagnoses that we take care of, there are in-office treatments, there are medications, and there are surgical options as well. It just depends on what they are dealing with and what would be the best treatment for their symptoms. I spend probably half of my time in the operating room surgically repairing or treating pelvic floor issues, and then the other half are clinic treatments. So it just depends on what they're seeing me for.
Okay, okay. So it sounds like it's a fairly balanced approach. It again just depending on their issues and severity. Okay.
Absolutely. I always like to provide non-surgical and surgical options if there are both available. I like to offer
Okay.
both. Mhm.
Okay. How long have you been in practice, Dr. Allen?
Good question. It has been 11 years. No, it'll be 12 years this year. Yes.
Oh,
12 years.
excellent.
Yes.
Excellent. Wonderful. I've been in practice quite a while, and I always say I started when I was 10.
Yes.
I,
Yes. There
I
you
hate
go.
to add the years up. You're still very young. That's not a problem. But you've been doing it long enough that you
Mhm.
have probably seen lots of similar issues, and it's I don't want to, I guess I don't want to belittle it, but when you've been around 10 years or plus,
Mhm.
you're
Mhm.
like, I've seen this. This is a common problem and I've seen it and I know how to fix it. I'm assuming you
Yes.
feel that way.
Yes. I do. I do. At this point in my career, I do feel comfortable with what I can offer patients and the little nuances in patient care in my specialty. Absolutely. There's not very
Okay.
many things I feel like at this point. There's not very many things I haven't seen.
I guess that's true. That would be true. What questions do patients frequently ask you? Are there several frequent questions that, like if they could search under frequently asked questions, would there be two or three of those that you might have?
Yes. You know what I get asked every day is how common is this? So if I have a patient that I've seen who has a fallen bladder, for example, um, they'll almost always I get asked, how common is this? And is this what a lot of women have? And the answer is yes, it's very common. A fallen bladder is the most common form of prolapse that a woman can have. And there are estimates that up to 30 to 50% of women will have some form of prolapse in their life. Now, that's not saying that they will all seek treatment for that, but it is very common. And so that is a question I hear a lot.
Okay.
I also get asked a lot if when I'm talking about surgical options, if mesh is the only surgery available for prolapse or incontinence. And the answer is
Uh-huh.
no. Mesh is not the only option. There are a lot of non-mesh options. And so there's a lot of discussion about mesh products in my office as well.
Okay. And I would assume that you're always willing to discuss options at length with your patients.
Yes, absolutely. A lot of what I do is educating the patient so that they know the diagnosis that we're dealing with and what all the treatment options are and the risks and benefits of each. A lot of talking.
Okay. And I can tell just from listening to you and watching your face light up when you talk about your profession that you really do enjoy your work. I can tell
Mhm.
that.
Yes,
I can see
it is
that.
rewarding.
I do work with you in the operating room, and I can see that too. when when I'm on that side, I'm on one side of the drape doing anesthesia, and Dr. Allen will be on the other side doing the surgery, and I can tell that she loves her job. It's very
Oh,
obvious, and I'm sure patients see that too when they come
I
to
hope
meet you.
so. I do. I hope so. I hope that's the case. Yes. And I love
Is there
having
any
you in my operating room.
is there anything that you might want to add that I haven't thought to ask?
Hmm.
I
I
think we've
would,
covered things,
I
but
think
if
we
there's
have.
something else.
I think I would say for any woman out there wondering if they have a pelvic floor issue, um, first things first is go see your local OBGYN and have a quick exam and see if they do in fact see some sort of pelvic floor issue, or have them screen you with questions in a quick exam to see if you may need a urogynecologist's help,
Okay.
because these issues are common, and there's a lot of really good treatment options out there. There really are.
Okay. And then after they see their regular gynecologist, there would be a referral made to a urogynecologist if things are found that need treatment.
Absolutely, that's exactly right. Yep, yep. Most of the patients that I see are referrals from a gynecologist. Hmm.
Okay. Okay.
Yeah, that's
All
right.
right. Well, I think this has been very educational for me. I hope it is
Oh,
educational to
good.
other people out there that are wanting to at least learn about it. And we're going to continue to have further discussions and get more in depth about issues, problems, patients' problems, issues, and treatment modalities.
Awesome. I look forward to it.
All
Thank
right.
you. Thank you
Signing
so
off for
much.
now. Bye
All
bye.
right. Bye bye.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at shetv.com.